My name is Javier Galvan, and I'm a recent graduate of the UCSF School of Medicine and was also in the Prime US program. Um, I'm the son of Mexican immigrants. I was raised in a single parent household. I grew up poor. My mom did everything she could to ensure our success, but seeing how she didn't have her own proper education, the only goal she had set for us was to graduate high school. So immediately after graduating high school, I decided to enroll or enlist in the United States Marine Corps, where I was a mechanic. Um, and I plan to do that as a career, just as an outlet to get away from the community that I grew up in, the neighborhood. We grew up in like Section 8 housing, so it was unsafe. Um, Luckily or fortunately, right before my deployment to Afghanistan, I was trained to be a combat lifesaver. And that's when I realized that I enjoyed the corpsman's job, which is the Navy, like the Navy hospitalist. I enjoyed their job better, more than I enjoyed my own job as a mechanic. And that's when the seed was planted to pursue medicine. But at the time, I had no aspirations to do so. And then during my deployment in Afghanistan, which was in 2009, Congress passed the post 9/11 GI Bill. And I remember we had an assembly and all the higher ups told us about this bill and how they would pay for our education. They would give us a housing stipend. And then that was the moment I realized that I should probably pursue something bigger than what I was currently doing. And at that moment, I decided to leave the Marine Corps. Um, I left the Marine Corps in 2010, so I had a year left in my contract, and I didn't want to throw everything I had away, so I enrolled in a community college called Palomar Community College, which was down in near San Diego or near Camp Pendleton. I think it's San Marcos, and they offered classes on base, and I got A's in both those classes, and it was at that moment that I said that I could definitely leave the Marine Corps and pursue higher education. So I enrolled in a local community college here. I'm from Livermore, California, and I enrolled in Las Positas Community College. Um, and I guess to touch base on some of the obstacles that I faced is I left the Marine Corps. I had no idea what I was doing. I said I was going to pursue medicine. I didn't know what that meant. I didn't know of any medical schools that existed outside of UCSF because they ran the pediatrics department at Valley Care here in Livermore. And I would see their signs on the bus. So I knew that school existed, looked it up, found the admission criteria, printed that out, used it as a guide, but it still wasn't enough because it was vague and they just said they required like a year of biological sciences, a year of physics, a year of chemistry, but it wasn't very specific as to what courses you needed to take. And I didn't know anybody who had gone on to college to know specifically what I needed to take. Fortunately, I was using the GI Bill. And they force you to see a counselor. So I saw a counselor. I talked to the counselor. I asked her, you know, what I had to do, what classes did I need to take in order to pursue a career in medicine. She said she didn't know. I find that hard to believe from a counselor, but nonetheless, she said she didn't know. So then I was on my own. My last semester at Las Positas College, I was fortunate to meet Marcella Anthony over at Stanford with the Health Careers Opportunity Program. And she came to talk about that program. I applied for it. I was fortunate to get it. And it was then that I found the guidance and the mentorship that I needed. And I largely attribute that to being mentorship and guidance from people who look like me, who were eager to, help me succeed. They wanted, the workforce to look like them, to represent California. So then they told me the classes I needed to take, and I met some other people at San Francisco State University that were in the HCOP program at the time. I transferred over to San Francisco State. I was still on the pre-med track. I met with the advisor at San Francisco State, and then they told me that I shouldn't apply into medicine despite having, I don't remember what my GPA was at the time, but it was pretty competitive. And they discouraged me. I applied anyways. I ended up getting into UCSF. I joined under the Prime US program. Another obstacle that I faced once I got to UCSF was how do you finance medical education, just because it's so expensive. I didn't know anybody who had gone to medical school or who had graduated from college. So it was all new to me. My first semester, they gave me this financial aid package and included loans. And I remember thinking, this is ridiculous. Like, I'm not going to take out loans to survive. So I returned the loans. I kept the financial aid that they gave me, but it was only enough to pay for tuition. So I had to like skip a couple meals. I started applying for a bunch of scholarships. I applied for Veterans of Foreign War scholarship. They gave me some money. I was fortunate enough, like Dr. Cook said, to receive the Paul and Daisy Soros Fellowship for New Americans, which ended up covering third and fourth year of medical school. And then I was able to finance the rest of my education that way. Like she also mentioned, I was at Hopkins where I studied public health and I focused on health finance and management. And that I was fortunate to be selected as a Sommer Scholar for that. So I also had that covered. Just graduated, I want to say last week on Monday. I'm going to be an intern at Highland Hospital in Oakland. And then I'll be doing diagnostic radiology or training to be a diagnostic radiologist